Welcome back, students. Now this video is for the Viva on the ribs. Okay, so we will learn about the questions which may be asked on the ribs. Okay, and these questions are usually asked, and the question will be on the ribs. First, what we will see that the general question here. The first question when you will pick up a rib will be that how you will classify the ribs. Okay, the classification of rib, because there are different types of the ribs are there. So you can say that the ribs are classified as the true ribs, which is between first to the seventh. Okay, because these two ribs they articulate with the sternum through the costal cartilages. Then the second class of the ribs are called as false ribs, and they are from 8 to 10. That means 8, 9, and 10. They don't directly articulate with the margin of the sternum, but they articulate through the costal cartilage which are attached to each other. Okay, so these are called as false rib. But then the third class of the rib is the floating ribs, and these floating ribs they just have a small cartilage, hyaline cartilage on the tip of these bones. They are the 11th and the 12th rib. So the floating ribs are 11 because they don't come towards the sternum. Okay, neither they articulate directly or not through that of the costal cartilages. Okay, costal. So these are the three classes of the ribs. Okay, then next question may be that, okay, which is the longest bone in the body? So you can say that the seventh rib is the longest rib in the body. If we go above that, there will be the decrease in the size, and if you go below this, then the seventh there will be the decrease in the size. Another question which is asked as a general question, okay, what are the bony features at posterior end of the rib? Bony feature in a particular vertebra at the posterior end of the rib. Then you can say that this, let me show you in a typical rib here, okay, which is seventh or the sixth rib it is here, that the posterior end, this is the posterior and this is anterior, and you show your examiner that the posterior end has the three parts. There is a head, then there is a neck, and then there is a tubercle. So this is the head, neck, and tubercle. Head has two demifacet, one the upper demifacet for the articulation with the lower margin of the upper vertebral body, and the lower demifacet, which is usually bigger, it is for the articulation with that of the lower body, that is near the upper margin or upper border of the body. And in between there is a ridge here, and this ridge also gets attachment to the intervertebral disc. So this is the head. Then you can say that there is a neck, and neck is antero-posteriorly flattened, and at the upper border of the neck there is a crest-like structure where I am just putting the finger. You can see with the wire, this is the crest of the neck which gives attachment to the ligament. Okay, superior costo-transverse ligament. Superior is attached to this crest. Then you may show him that there is a roughening is seen in the posterior surface of the neck, which will give attachment to the anterior costo-transverse ligament. Okay. Then there is a tubercle, and tubercle is divided into two parts, a smooth part medial and a lateral rough part. The smooth medial part is articular in nature, and it articulates with that of the transverse process, costal facet of the transverse process to form the costo-transverse joint. And then the lateral part is rough part, and this gives attachment to the lateral costo-transverse ligament. So the medial end of the rib is very firmly attached to the transverse process as well as to that of the head. Then he may ask you about show me the borders and surfaces of the shaft. This part is sharp, which is this is the angle where there is an oblique ridge is seen here. This ridge, if you are able to see it, this is at the oblique ridge the rib which was running posterolaterally, okay, posterolaterally turns and then it goes forwards, okay, it goes forwards and medially. So this is called a shaft, and shaft has two border, a superior border which is rounded and an inferior border which is sharp, and it has two surface, an external surface and the internal surface. Near the lower margin of the internal surface, you can say that there is groove which is called as the subcostal groove, which gives passage to the intercostal nerves and vessels. They lie here. Then he may ask you about the attachment of the intercostal muscle. You can say that both the borders, they gives attachment to the intercostal muscle, that is the external intercostal, internal intercostal and innermost intercostal. The origin takes place from the lower border of the upper rib. The sharp outer margin gives the external intercostal. The floor of the costal groove gives the internal intercostal, and the medial surface or internal surface, this line gives attachment to the innermost intercostal, okay, innermost. So these are the intercostal muscle which takes origin from the upper ribs and insert onto the superior border of that of the lower rib. Okay, I think this many question can be asked from the rib side. Then he can ask you that now since you have told the bony features, you tell me to which side this bone belong. So keep the ribs in such a way that since it is a twisted bone, if you will keep it on table, the head and neck will be upside. But in the anatomical position, inside determination, you should see that the shaft, upper border of the shaft should be rounded and the lower border should be sharp, should be kept here. Okay, and then the head should face medially. Okay, head should. If you will just recognize the three things, head facing medially towards vertebral column, okay, rounded upper border upward, then this will give you the side. This belongs to the right side. This belongs to the right. You cannot keep it like this, because then the inferior border, which is sharp and costal groove, will become upward, okay, upward, though the head is facing medially. So it should be always the rounded border, upper border should be upward. Then its anatomy, as I said, that this rib is twisted, and then this rib should have to be kept for anatomical position. Head and neck should be at a higher level, close to the median plane, and then the shaft should go downwards and forwards like that. Okay, which will end, it will articulate with the costal cartilage to articulate with the sternum. So the medial end will be much more medial as compared to that of the anterior end, like that. Okay, anterior. It should be much more medial as compared. I think this is giving the full view, okay, full view. So here medial end is medially. This will complete the Viva on the ribs. Thank you very much for watching this video on rib.